Hello, it's Dr. Dave, the ENT doctor. Did you know that a lot of ENT doctors actually get involved with managing hay fever and allergy? And the reason for this is relatively straightforward, because we're also nose doctors, and it's not unusual that we will see patients that have nasal allergy problems. And they may come and see us straight away, complaining about blocked nose, runny nose, sneezing, or they might have seen an allergy doctor along the way. And as part of the overall management, obviously with hay fever and allergies, is knowing what to do about the allergies. So that's what I want to take you through. So what is hay fever? Well, hay fever in medical terminology is what we call allergic rhinitis. Rhinitis means inflamed nose. So from that point of view, what happens in simple terms is that in the mainstay, usually it's something in the air that is inhaled into the nose. It touches the skin lining, and the person, if they're sensitive to that thing, will then mount an immune response, and that immune response will then result in a whole lot of irritation and what we call inflammation. And as part of that inflammation, there are certain chemicals that are released, and those chemicals then affect the lining of the nose, and that then leads to things such as swelling of the tissue, which causes a blocked nose. It leads to excess fluid leakage from the nose, so that's the runny nose. The irritation sets off the sneezing reflex. And then you get a release of things that are quite irritant, that make you itchy, and it can extend to getting an itchy throat, itchy eyes as well. So it can be more than just the nose. Probably the most four-ish common things would be dust mite, grasses and pollens, animals, molds. They would be your big four. Plenty of other things, but they're your big four. So what do we do about allergies? Well, it's helpful to try and work out what you're allergic to. So you may have some allergy testing. And broadly speaking, there's two ways of doing that. One is with a blood test. We have a blood sample taken, and they can measure the blood to see if there's any suggestion of allergy reactions going on. Or the other way is that we can do little scratch tests along the skin. And again, when we do that little scratch test, we just put a little bit of what someone could be allergic to onto that scratch, and with that exposed scratch, you get blood coming in, and if there's anything in the blood that causes a reaction, it'll show up that way as well. So they're, broadly speaking, the two ways to look for what you might be allergic to. And then if you can work out what you're allergic to, you may or may not be able to do something about your environmental exposure to it. It's pretty hard if it's trees and grasses. It's not necessarily palatable if it's animals. If it's dust, then that's an environmental thing that is, generally speaking, easier to manage, because you can look at things, especially like children, fluffy toys, protective covers for the mattress and the pillow, vacuuming the room, washing things in hot water. But the problem is, like dust mites, you never get rid of them. They're just everywhere. Anyway, we can then go through medical treatments, so that can be using salt water in the nose to wash and rinse the nose out, keeping it clean, reducing exposure. We can use nasal medications such as nasal steroids, which are anti-inflammatory steroids, to bring the tissue response down so you don't get as much in the way of irritation. But for the longer term, it'd be kind of nice if those allergies could be made to go away. And that is in fact possible to varying degrees of success. Nothing's 100%. But there's a treatment called desensitization. So if something goes in the nose and you're sensitive to it, and we're trying to make it so you're not sensitive to it, then we're going to desensitize you. That's how the word comes together. And if you want to be fancy, we can say immunotherapy. Immuno relates to the immune system, and therapy obviously is trying to change that. And essentially what desensitization or immunotherapy involve is the deliberate exposure to the person to what they're allergic to, but in very, very small doses, and in a route that is different to the nasal route. Because one of the interesting things about the immune system is that different parts of the immune system are more active depending on where the exposure comes from. So, for example, what we can do if people are got a nasal allergy, we can do treatment under the tongue. Okay, so onto the what we call the mucosa of the nose. Or something that's actually possibly more effective is little subcutaneous, so under the skin, injections. And what happens is that different parts of the immune system have an opportunity to recognise and react to what we've put under the tongue or injected. And that part of the immune system is different to the allergy part of the immune system. And what we're trying to do over time is basically get that different part of the immune system turned on in such a way, in such a manner, that when someone then is exposed to something inside their nose, there is more than one part of the immune system that can potentially react to that thing. And if we can get more of the non-allergic part of the immune system to react to it than the allergic part, then the allergy symptoms go down. So that's it in a nutshell. Now, the thing about the immune system is it does change over time. So some people, when they have this done, they need to have it repeated down the track. And for some people, they're just not responders. The allergy part of the immune system is just too aggressive, and the other parts just can't make up for that being the case. So it's not for everyone, but it's definitely for people where they're suffering with their allergies and the hay fever symptoms, and they don't want or don't like the prospect of being on nasal steroid sprays forever. It's a great option. And the best success we have happens to be if they've got dust mite allergy. And then number 2 on the list is things like grasses. The response rates there are really quite good. It is a prolonged course of therapy. It's not unusual that it could go for 3 years, even longer than that, because for the immune system to basically trick it and change it, it takes a long time. So you can't rush a good thing. So that's that in a nutshell. So I hope that helps if people understand the topic a little bit better. I am a huge believer in immunotherapy and desensitization, especially, as I've said in another video, if someone has hay fever and allergy to the point that they need surgery just so they can breathe properly. Those people really have bad allergies on the table, and the worry is those allergies could cause the swelling to all come back and block their nose again. We don't really want that to be the case. So surgery certainly doesn't fix allergies. It fixes breathing by removing the allergy swelling, but then we need to try and stop that allergy swelling coming back again in the longer term. So again, that's where that immunotherapy come into play. So I hope that helps you understand the topic. Bye.